5 in your health tonight, tracking the spread of bird flu. Experts say they've now identified the first human infection from backyard chickens. Here was some advice as Dr. Kristen Moffat, an infectious disease specialist at Boston Children's Hospital. Good to see you, Doctor.
Hey, Dr. Moffat. We actually heard from you yesterday in a little snippet, but let's expand because let's start with this is a patient in Louisiana. So it's not in New England, it's not in Massachusetts, it's in Louisiana. So why is this case, the one case out of 339 million people, getting so much attention?
Yeah, I think really for two reasons. The first is that this is the first of the 61 confirmed cases in the U.S. so far with this bird flu. This is the first case of severe illness, really due to bird flu requiring hospitalization. And the second reason is that this is the first case that likely was transmitted through contact with a backyard poultry flock. Most of the cases so far occurred in people who worked in dairy farming or in otherwise in the poultry industry. And so that really allowed for identifiable risk factors for a population that you could really target with enhanced precautions and with enhanced surveillance. But if you think about how many families have backyard poultry flocks, that really could open up the risk to a lot of additional people and exposures.
That's a good point.
No, it really is. So do we specifically know how people are getting infected? Is it from touching these birds? Is it eating eggs? I think that's important to make that distinction.
Sure, yeah, it's definitely important. And so most of the cases so far have been from contact with sick animals. And so that could happen through having contaminated hands and the virus is on your hands, and then you maybe rub your eyes, which is a good entry point for this virus. It's also important to know that sick animals can shed the virus into some of the bedding or litter or soil underneath where they are housed. So when that soil or litter gets churned up, it becomes airborne and people could inhale the virus that way. In terms of getting the virus through a couple of food items, one, raw milk has gotten a lot of attention. Raw milk has been known to be able to infect pets previously when the raw milk came from infected cows. Whether raw milk can be a source that infects humans is still being investigated. Raw eggs from the grocery store are pretty unlikely to be a source for transmission just because birds get really sick really fast from the bird flu. And these bird farms have so many regulations in place such that those eggs would likely never make it to the market.
Dr. Moffat, though, let's expand on something you mentioned earlier, because you're right, a lot of families do have backyard chickens.
Yeah.
So do you think it's still safe to keep your backyard chickens?
Yeah, no, it's a valid question. I think a lot of families get a lot of enjoyment out of their backyard flocks and some really delicious eggs. But I think it is important for families with backyard flocks to do a few things to just keep themselves, their families, and their flocks safe. And the first is to really minimize their flock's exposure to wildlife and to wild birds. So that may mean making sure that the coop has good closure on it so that wild birds, for example, could not introduce bird flu into the flock. The second would be for people to understand that there are some populations that are more susceptible to very severe infection, not just from bird flu, but from infections like salmonella, which can also be associated with backyard flocks. So that might include pregnant people, very young infants, or people with a compromised immune system. So those people really should not have contact with flocks. Nobody should have contact with birds or poultry in the backyard that appear ill, and they shouldn't touch the bedding or the litter from those. They should be in touch with their Board of Health. And children should always be supervised around a backyard flock and should know that they need to do really careful hand hygiene after contact with the flock.
Yeah, it's an important conversation for sure. Dr. Moffat, thank you so much. Happy holidays to you.
Thanks, Dr. Moffat. Have a great holiday.
You as well.